Hi, I'm Jim. Today I will talk about medical assisted dying in Canada and advance directives. Interesting yet? Let's go. Okay, first things first. History class. Not until 2014. Assisted suicide or mercy killing was illegal everywhere in the country under the Criminal Code of Canada and carried a penalty of up to 14 years in prison. Nowadays, 6 states of the USA, the Netherlands, Switzerland, Luxembourg, Colombia, Belgium, and Canada are 7 countries that enable physician-assisted dying. Prior to Bill C-14, many Canadians challenged the law on the rights to liberty and autonomy under the Charter of Rights and Freedoms. In 2014, Quebec became the first Canadian province to adopt the legislation which enabled assisted suicide. Quebec government held that doctors could administer a lethal dose to patients who had repetitively made consent for aid to die. On June 17, 2016, Canadian federal government passed Bill C-14. Physicians and nurse practitioners can assist patients in dying. The government stated that this is the first step for compliance with the Canadian Charter of Rights and Freedoms.
So, how bad are end-of-life symptoms?
Really bad. Canadians are living longer. As a result, they are having more complicated and overlapped health conditions as they get older. Although prognoses of survival vary dependably on type and stage of the disease, in general speaking, the later stage of the disease, the poorer of the prognosis. In advanced cancer, for instance, prognosis is the key factor in clinical decision-making. Terminally ill patients suffer from end-of-life symptoms such as pain, continuous fatigue, anorexia, cachexia, etc. Prognoses depend on clinical signs, symptoms, lab, and imaging findings. In last stage of diseases, those symptoms prohibit any individual to behave normally, therefore, reduce the quality of life. End-of-life problems have been brought into the news when Quebec's Bill 52 was passed in June 2014. Also legal in Quebec at that time is palliative sedation, which means putting an individual into coma and then having life-sustaining measures such as feeding tube, ventilator, etc. removed. So, what is autonomy and how does it affect the decision of assisted dying? Autonomy in medical context is defined as a person's right to self-determination regarding his or her own health care. Meanwhile, euthanasia is ending a person's life in order to relieve the pain caused by an incurable disease, which means a good death. Euthanasia is the intentional termination of a person's life at their request or expressed wish and is preceded by a physician. Yes, it's complicated. Our lives are full of problems. Even when we're about to die, we still have problems. Say I'm dying because of mitosis disease. To anyone who doesn't know what ptosis is, it is a disease that my eyes muscles are too tired so the eyelids always fall down. Okay, I'm dying, and I want use MAID. What options do I have? There will be 2 types of MAID in Canada. One is the situation in which a physician or a nurse practitioner directly administers the substance to the person who requested. The other situation is the physician or nurse practitioner prescribing or giving the substance to the patient and letting the patient self-administer. In order to be qualified for MAID, the individual's natural death must be reasonably foreseeable. There are criteria to determine whether a patient has a grievous and irremediable medical condition, as well as whether the patient is eligible for MAID. Other healthcare providers that assist in dying with dignity, such as pharmacists, social workers, hospital lawyers, are also protected from liability. However, Bill C-14 does not put any timeline to determine whether an individual is terminally ill.
But can the patient make a living will or treatment directive for dying when they're in terminal phase?
So, let's talk about Advance Directive and Advance Request. Advance Directive is the document in which patients say their wishes for future medical treatments when at a later time, they are incapable of making such decisions by themselves. Advance Request, on the other hand, is the document defined as a competent adult making a request to die later in their lifetime when they lose ability to make decisions by and for themselves. However, current federal law does not allow individuals who have been approved for MAID to make advanced request. Now, What are ethical considerations around MAID? Many people have challenged Bill C-14 on ethical aspects, such as how have the goals of medicine been changed since MAID law was passed? How do MAID and assisted dying influence physician-patient relationships? Or how do they affect healthcare team dynamics? Well, answering is not an easy job. Previously, relationships between physician and patient were usually respect and power toward the doctor regarding decision-making. Now, that power is shifting away from physicians. Moreover, physicians who have opposite viewpoints about MAID may have troubles in workplace, which can cause stress or disrespect the senior physicians. The goals of medicine are curing and preventing from sickness and death. Now and perhaps at later time, medical students will be educated to assist a person in dying, beside curing and treating. In medicine, ethical theories have large impacts on clinical decision-making. For example, according to deontological theory, a moral and honest action taken is considered ethical, regardless of the outcome. Okay, that's enough for today. Thank you for watching, and goodbye.